Got it. Okay, so I guess I'm live again. Good morning. For those who haven't known me yet, new in my channel, I've seen some new subscribers from yesterday, and thank you. First, thank you for subscribing in the channel and watching my videos. I hope my videos are helping you get some information. I'm going to be checking for some maybe comments that you have left, or maybe if you got questions from the previous think Leia video. Yeah. Well, I'm doing live videos because I really don't have I I can't do editing, like, I can't do screening of the videos that I made, and it's okay, whatever comes out of my mouth, that's what it is. But that means I'm not sugarcoating anything. So today is Wednesday. Today is Wednesday, and the date today is January 11th. Is it 11th? Yeah. January 11th, 2023. This is so far my 17th day of stay in a hospital. So I have stayed in two different hospitals. I have one from the hospitals at the hospital near where we live, and right now we're here in a bigger city. It's a bigger hospital, hoping that they could be able to help me out with my blood issues over here. And my last hemoglobin was checked 2 days ago, and that was it just went up a little itty bitty up, from 4.7. It the last check was 4.9. So expect that there's still dizziness, but I am able to get up and go back and forth the bathroom because I don't want to use a commode. But the bathroom is just near, it's not so bad, but it's always a task. It has always been a task because once I get back to my bed, I'm always short of breath, which you can expect from a patient that has a very low hemoglobin and platelets. But today I kind of feel okay. I'm just very hungry. My breakfast not here yet. I already called in, and I think I have a little bitty hint of what do you call that, pinkish thing there on my lips compared to my last video. So I want to feel positive about that. And here is my view today. And there, and that's my view. I just have two big windows over there. And at the moment, I'm waiting for my family to get here and visit me, my husband and my 3 kids. I have 3 kids, 16, 12, and 4 years old. I'm hoping they're on their way. But yeah, I have a list over here that I would like to talk about here in this video. So my next plan, the next plan, the next time that they're going to check my hemoglobin, hopefully is going to be tonight. So there were 2 nights intervals. So I'm hoping it's not just 0.2 increase. I would like to hear like, hey, it's already 5.5. Or, hey, you know what? It's already on 7. You can go home. Because, I want to go home. I mean, it's 17 days is a long time to be away from a place where you feel comfortable, and that's home. But well, there are three different doctors, oncologists that visits me over here that do the rounds. One of them just did once, and there were two other oncologists that they alternately uh, do the rounds. Sometimes the lady doctor stops by in the no, in the afternoon, and the guy doctor in the morning, always in the morning. But this other doctor that sat down here with me said that, you know what, I don't think it's a hemolytic anemia anymore that's doing the issue about your blood. It is the fact that your cancer has the cancer is it's in your bone marrow, and the bone marrow is being very, very stubborn in making red blood cells. It's very slow in making red blood cells, and the process of producing red blood cells using EPO is going to be very slow. And I understand that. Yeah, they've already mentioned that. They've already talked to me about that like quite a few times already. I, since as long as I'm still breathing over here, I'm very patient. I can wait. But they are, all of them are like, saying that, it's, if your symptoms, if your symptoms gotten better, well, we can just go ahead and discharge you, and you can get the EPO shots through outpatient. And that's what I really want to do. I want those side effect, no, not side effects. I want those symptoms to be gone. But here lately, it seems like they want they want to send me home with or without the symptoms. And it kind of worries me because, it's not that I don't want to go home. I want to. I want to go home. I miss my house. I even dream about my house a lot of times in the night, because that's how I miss it. I miss being with my family, with the kids and everything. But the last time I did that, the last time I requested for the previous hospital to let me go home, I only spent one night, and the next day I collapsed. So and that makes me feel like, I'm not ready for a home setup. And that time that I got discharged from the previous hospital, my hemoglobin was a 4.9 also, same as what I have right now. So yeah, so far the doctors over here have not mentioned anything about the hospice care, because I'm pretty sure from the information that they got from the previous hospital, I'm allergic to that word. I mean, a doctor could only offer that once or twice, and it should be it. If the patient says, no, I'm not ready for it, stop rubbing it. We're not ready. If we said we're not ready, we're not ready. I mean, who would like to die in pain? Who would like to die suffering so much? If a patient feel that they're ready, they're going to be the one to seek for it. But so far, the doctors over here hasn't been really mentioning anything about the hospice. Maybe because they're not my oncologists; they're just the physicians here in this hospital. So yeah, I'm reading on my my notes over here. Yeah, so far that's the only thing that's been going on right now. The female doctor, I like the female doctor over here. She's very nice. She explains stuff really clear, and I feel that she's when she talks to me, she's a very, she chews her words. I think the first few times that the other guy doctor came over here, he was the same. But here lately, the last 2 nights, it's kind of changing. And especially this morning when he came in, I was sleeping and he just knocked on the door. Of course, I was like, oh, hi, and then he was asking me, oh, how are you feeling today? I feel okay. And then he said, okay, what about the going home part? I was like, well, I talked to the lady doctor, and we talked about that the other day, and we're going to have to check my hemoglobin first. So it's kind of like for me, oh, so you have plan on going out? Go home. All right, so I kind of feel good about doing videos like this because it kind of helps me. It helps me voice out what I think about this whole hospital stay and how people are treating me. Nurses over here and the from the previous hospital, they're phenomenal. They're really very good and they're very nice. Some doctors are nice too. They talk to you with sympathy, but some are not. Some are just, I don't know how to describe it. I don't want to say anything negative. But maybe because, they're thinking, hey, you know what, you can just go home and do the treatment at home. And but for me, and in my perspective, they don't know how I feel. They don't exactly know, had their hemoglobin dropped down that low, like the lowest that I had it when the first day that I got admitted over here was 2.6. It went down to 2.6. That was tough. That was really tough. 2.6. When your hemoglobin drops to 2.6, it was like everything's kind of like spinning, and I was having headache, but I was still coherent though. Doctors could still talk to me and I could still answer their questions. And the lady doctor actually told me here, can I, she said, can I be honest with you? And I said, well, of course. And then she said, because, for a person that has a 4.7 or 4.9 hemoglobin, we're actually thinking how we could still be able to communicate with you, that you could still be able to talk to us. And like right now, I don't know what my hemoglobin is right now, but I feel dizzy a little bit, but I can still talk. I can still make facial expressions, and I could still complain. But anyways, it's morning, so far so good, and I'm expecting this to be a better day for me because I'm gonna be seeing my babies. So I'm gonna have to say bye for now, and we'll give you guys an update about what's going on with this blood of mine. If you have any question, want to share nice words, kind words, just leave it in the comments below. I'd be more than happy to read your comments, guys. And thank you so much. You guys have a great day, and please stay healthy. Eat healthy foods. Don't eat deep fried foods. avoid stress. Stress is it's very bad for your health. Learn how to forgive. Try to think happy thoughts, and you should be good. Thank you so much, guys. You guys have a great day.